Hello, I'm Colonel Jerry Chester, the Clinical Training Officer for the Medical Readiness and Training Command, headquartered at Fort Sam Houston, Texas. We're here in Rochester, Minnesota at the Mayo Clinic to conduct a Team STEPPS exercise with the 228th Cache, also headquartered at Joint Base San Antonio. Team STEPPS stands for Team Strategies and Tools to Enhance Performance and Patient Safety. Studies have shown that increased communication amongst healthcare professionals decreases the chance of medical errors and results in a more successful patient treatment. What's the risk? Patient safety. On May 20th, 2018, the New York Times reported that the American healthcare system is responsible for more than 250,000 deaths due to medical error, or the rough equivalent of a jumbo jet crashing every single day. Here at the Mayo Clinic Multidisciplinary Simulation Center, MRTC has partnered with RTS Med to replicate a combat support hospital with all the major functional areas, EMT, OR, ICU, as well as the ancillary services, pharmacy, lab, and x-ray, as well as PAD. And we simulate patient flow as it would be in any military treatment facility in the field. Here at our Mayo Clinic exercise, the scenarios are taken from the Joint Trauma Registry and are cases that actually occurred in Afghanistan and Iraq. That helps us to add a level of fidelity and reality to our training. Each functional area is overseen by an observation booth known as the crow's nest, where the high-fidelity mannequins are manipulated and controlled to replicate the physiologic response to the treatment. Every minute of the exercise is recorded both on audio and visual for the purposes of the joint AAR that we hold at the end of the day. Here are two tools within the Team STEPPS framework that help to decrease avoidable medical errors. The call out and check back.
How can I help you, sir?
Patrick, my name's Major McGrath. I'm here to pick up some blood from my patient.
Who's your patient, sir?
My patient is Blair DeFazio. Last number is Tango 008, and I need to pick up 2 units of whole blood.
Blair DeFazio, Tango 0008.
That's correct.
Right. Got your units. So, Blair DeFazio, T0008. First unit number is 0014.
Okay, I'm checking back that I've got Blair DeFazio, T008, and the unit number is 0014, and it expires on 9/30/2019.
Correct.
At the end of each scenario, there's a small group after-action review within each section, which sets us up for the large group after-action review that's to follow. As we do the large group AAR, it allows each section to benefit from the teachable moments occurring in sections other than their own. The Army Reserve and the Medical Readiness Training Command are extremely fortunate to be able to collaborate with the Mayo Clinic, a world-class medical institution.
The thing that's so important to me here is being able to apply our Team STEPPS to bring it into an environment where each of my soldiers know as we go down range, regardless of whether they're the colonel or the private, that their job is to make sure that we deliver world-class health care to our warfighters and that their voice is the one that matters.
I had noticed during one of the scenarios that the patient was crashing. They were going into cardiac arrest. I was the only one who had noticed it, so I knew that I had to speak up and say something. Team STEPPS has empowered me to really do the right thing and to speak up when I need to, not to be hesitant and to have confidence in what I'm saying when I need to.
Communication is important because when we look at patient to patient, when we transfer over, if we communicate the wrong diagnosis or the wrong medicine, that could actually be fatal for the patient.
There is no better return on investment for our training dollars. I want you to know that the MRTC Team STEPPS exercise at the Mayo Clinic is by far the best way to prepare units to deliver safe and efficient patient care.